Hello. So Dr. Pagidipati is our guest of honor this evening. I've been talking about eating for controlling blood pressure, but I'm happy to turn over to you. Dr. Pagidipati is a specialist in hypertension in cardiology. So at Duke.
Sure. Sure. Well, thank you. Thank you guys so much. I'm Neha Pagidipati. Obviously, I know Dr. Biola. I've met Dan before. Nice to see you again. And I don't think I've met either of you before. It's very nice to meet you. I'm a cardiologist at Duke University, and I have a particular interest in prevention of heart disease. And so a lot of my work focuses on high blood pressure and how we can help to control that and other risk factors that also contribute to, higher risks of having heart disease or stroke. Incredibly simple. So there's actually something, I don't know if you all are familiar, there's actually something called the American Heart Association has like this kind of thing to help people remember how to prevent heart disease. And it's called Life Simple 7. You can Google it, but basically Life Simple 7 is an incredibly simple but very accurate way of thinking about ways to control heart disease. And it really makes my job as a cardiologist very simple. And so the Life Simple 7 focuses on things that we can change, right? So there are a lot of things that affect our risk for heart disease that we can do nothing about. If you're a man, you have a higher risk than you would have for heart disease if you were a woman. If you are older, you can't change that. You're at a higher risk. If you have a strong family history, and a lot of people in your family have had heart attacks or strokes, you can't change that either. And so it's important for you and for your provider to know that about you so that we can make sure that we understand what your risk is for having a heart attack or stroke. But it's not something you can worry about because it's not anything you can change. So I'd rather have people focus on the things that they can actually change. And that's really what Life Simple 7 is all about. And so Life Simple 7 basically focuses on, 7 of the risk factors that you can do something about. So one, first and foremost, is high blood pressure, which is why we're all here. Hypertension is one of the leading causes, one of the leading risk factors for heart attacks and for strokes. And it really essentially is just putting a huge stress on your heart, right? You can imagine that if your heart with every beat has to pump against a lot of pressure, has to really force its way to kind of pump against a high pressure, that's going to put strain on your heart, and that's going to lead to bad things in your blood vessels. And when bad things in your blood vessels happen, you start to get plaque, and that plaque can lead to heart attacks and it can lead to strokes. So that's a really simple way of remembering that you're basically putting strain on your heart and on your blood vessels around your heart and in your brain. And you don't want to do that. So we got to make sure that we keep our blood pressure under control. And I think a lot of other talks, Holly, correct me if I'm wrong, have talked about how we measure blood pressure, how we keep track of our blood pressure, and how we control our blood pressure through diet and through exercise and through medications. So I won't focus as much on that, but just to say that those are all extremely important for controlling your blood pressure. Another thing, one of the single biggest risk factors for heart disease and strokes is smoking. Smoking cigarettes for sure. Smoking cigars, yes, as well. And then, vaping, we're still learning all the bad things around vaping. It's probably bad for your heart and lungs. It's probably bad for your heart. It is definitely bad for your lungs. So probably vaping as well. But at the very least, smoking cigarettes is one of the single worst things you can do for your health, not only for heart disease, not only for strokes, but also for cancer, for depression, for dementia, for peripheral vascular disease, and so forth. Then another aspect is really making sure that you know what your cholesterol is and that it's controlled. So if you have really high cholesterol, that's just laying down plaque in the blood vessels around your heart and going up to your brain. And when you lay down that plaque, it becomes much more likely that part of that plaque can flick off and lead to clot, either in the brain or around the heart. And that's what essentially a heart attack and a stroke are. So making sure that you don't let the pipes get blocked. And as we age, I think of it like pipes in a house, right? When you have a brand new house, the pipes are shiny and new and they're clear and you can see straight down them, and water flows really easily. As we age, gunk starts to build up in the pipes, and then it makes it harder and harder for the water to flow through. Same thing with the blood vessels around your heart, going up to your brain, going down to your legs, going in your neck. The same thing can happen. And the more gunk that you have built up, the worse that it's going to be in terms of getting blood flow to where it needs to go. So lowering your cholesterol helps to decrease the gunk buildup, essentially. We can lower cholesterol through a healthy diet, through exercise every day and through medications. And a lot of people, despite healthy diet and exercise, still need medications to lower their risk of heart disease and stroke, and that's okay. Another aspect is making sure that we exercise every single day. And I cannot emphasize enough how important exercise every single day is. It is proven to make you live longer, live healthier with fewer heart attacks and strokes, live happier, less depression, less dementia, less of, basically every kind of mental illness. And it is probably the single most important thing that we can do to keep ourselves alive, healthier, happier, longer. So the American Heart Association recommends 150 minutes, which is about 30 minutes, 5 times a week, of moderate intensity physical activity. And a lot of people ask me every day in clinic, what does that mean? What is moderate intensity physical activity? And it's exactly what you think it means. If you feel like you are huffing and puffing, you're getting your heart rate up and you're going like in middle of the road, you're not going as hard as you could, but it's not easy for you, you're probably doing exactly right. You're probably doing exactly moderate intensity. The other way that I think about it is that if you can talk but not sing, you're right where you need to be. So if you can talk and you can sing, you're not moving enough. You're going on a meander, and you need to not like walk the dog and stop and then walk the dog. You need to kind of hustle so that you get your heart rate up, and so you can talk but not sing. If you're going so hard and so fast that you can't even talk, that's fine. If you want to do that, you don't have to do that. If you want to do that, that's fine. High intensity is good, is good for you too. And a lot of people ask me, what about my heart rate? Where does my heart rate need to go? Don't worry about it. Honestly, it doesn't matter what your heart rate is doing, and it differs by your age, but it doesn't matter. Just if you can talk but not sing, you're doing great. So that's exercise. Then we talk about maintaining a healthy weight. And in general, a healthy weight is not where the majority of Americans are. So, 70% of the US population has overweight or obesity when you look at your body mass index. And we really want our body mass index to be less than 25, ideally. So that's when you divide your weight in kilograms by your height in meters squared. There are a lot of really good calculators. You can just pop your height and weight in inches and pounds into Google and see what your body mass index is, but you would really like it to be less than 25. So I focus less on the number and more on the general kind of concept of whether or not you've got problems associated with being overweight or obese, like diabetes, high cholesterol, things like that. But maintaining a healthy weight is extremely important. Other aspects are maintaining a healthy blood sugar. So we know that people who have insulin resistance, pre-diabetes or diabetes, are much more likely to get a heart attack or stroke. And we can prevent that by preventing the development of pre-diabetes or diabetes. So know what your sugars are, know what your hemoglobin A1C is. That's a lab value that your doctor can check. You don't have to be fasting, and it'll tell you in general what your sugars have been like over the last 3 months. And it's really important to know that, because that helps your doctor understand what your risk is for heart disease, and it helps to make sure that you're being treated properly in terms of your sugars. I don't know that I did healthy diet specifically, but specifically for hypertension, you do want to maintain the DASH diet. So basically the DASH diet is like a common sense heart healthy diet. It's not, it's exactly what you expect it to be. It's eating a lot of healthy proteins, green leafy vegetables, some fruit, but not too much fruit, not a lot of red meat, not a ton of alcohol. It's like, and not a lot of sweets. And it's exactly what you expect it to be, right? And so in that sense, it's very comforting that what you think is going to be heart healthy actually is heart healthy. And you want to make sure that you minimize your salt, right?
One of the criticisms I get from people when we talk about diet is tell me what I can eat, not what I can't eat. So we talk about limit your meat, limit your fried foods, no more than 3 eggs a day. Is that still a thing? No more than 3 eggs a day?
Yeah, we're doing a study on eggs right now, if anybody wants to join it.
But I try to push fish
I
and
say
nuts.
2. I say less than 2 eggs a day. You can have as many egg whites as you want, but I would say 2 or less eggs a day is probably fine.
I don't think we push nuts and fish enough. I feel like those should be.
I do. All fish and nuts, right? That is a part of the Mediterranean diet, but it fits into the DASH diet as well. It's healthy fats. And so fish have omega-3 fatty acids. We've probably all heard about omega-3 fatty acids, and everybody's like, oh, let me just take an over-the-counter pill for that. It's not the same thing, right? Eating fish gives you the pure form of the omega-3 fatty acids, and they are part of a heart-healthy diet that have been proven, at least in a Spanish population, to decrease the number of heart attacks and strokes that people have. So eating fish, and specifically fatty fish like salmon, salmon in particular, is incredibly healthy for you. It has 16 times as many omega-3 fatty acids as the next fish down. So if you eat salmon and green leafy vegetables every day of your life, you'll live forever, and exercise and don't smoke.
Thank you so much. And thank you, Dr. Pagidipati. We appreciate it.